Hi, my name is Dr. Paul Capel.
My name is Dr. Kristen Dorman.
Hi, I'm Dr. Michael Bardenwerper with Advanced Focus Eyecare. All right, so to me, healthcare, the word care is really what we should focus on. That's what I really try to strive for.
It's a very patient-focused practice, and we really want to provide any of the needs that patients have, whether it's that full exam, that diabetic exam, what kind of glasses can we best recommend.
To me, that means time spent with the patient. I want you to be comfortable. I want you to feel like you're at home. I want you to know that I care and that we are looking out for your best interest.
My favorite aspect about working here is when somebody comes back and tells me that what I recommended worked, what has been really successful. Whether it's a specific type of contact lens setup for somebody who's trying to see up close and far away and is struggling with the bifocal, is somebody with dry eyes and was struggling with that. It's coming up with a solution and then hearing that everything's been working well for them.
We're able to treat many different eye conditions, eye infections, get something in the eye, whether that's rust, you can perform those kind of surgeries even here, let alone routine exams obviously for glasses, contacts.
Another thing is the OCT machine, which helps us really check the health in the back of the eye for glaucoma, macular degeneration, things like that. And sometimes we can find changes with that technology a lot earlier than we would have with some of the older ways that we used to examine things.
Well, the retina wellness exam is really useful in monitoring any kind of progression and change of the inside of the eye. And one of the big things with many eye diseases is progression. Glaucoma is progressive, macular degeneration is progressive, and the only way that we really can get a good picture of that is with a photo that we can monitor every year, and then with the scan it also has more detailed information about everything that maybe the photo doesn't get.
I guess I believe that many of our patients continue to return year after year here because I think they know when they see and hopefully feel that we truly care about what we do. We take pride in it, and I care about my patients. I treat them like family. Every decision is again what's in their best interest, and I think that it's not just coming from me, but actually at every step of the process, from when you're being welcomed to the exam to when you're picking out glasses. We want you to feel comfortable, and that's why I think we actually just really enjoy seeing patients coming back year after year. That's one of the most fun parts about what we do.
It's willing to work with people, and even with the special needs and having trouble with a specific area of their vision, and just being patient and willing to try things that maybe other offices weren't.
Yeah, one of my favorite things is I really enjoy working with kids. I've enjoyed over the last several years seeing kids who go from getting their first pair of glasses and their reaction to that and kind of opening their eyes to a new world in a new way, and then seeing them come back again year after year after year, and now seeing those same children grow up. And that to me is what it's all about, is creating that relationship, and that's become really one of the most rewarding parts of what I do.
Well, we use special picture charts for kids just to make sure that it's not a question of do they know their letters, can they see their letters, so we have special tools that can help with kids at a younger age. And then also they usually have siblings in the same family, so it's great to see the same kids come back year after year. As they get a little bit older, we can continue to kind of evolve with the testing and check them and the whole family.
I think one of the misconceptions is that wearing glasses makes your vision worse, or wearing contacts makes your vision worse. And usually just addressed simply by saying, when you're wearing your glasses, your contacts, you're seeing as good as you can, and when you're not, you notice that there's things that aren't as clear, and when you have that that recent comparison, you can kind of pick up on that. Whereas somebody who feels like, well, I don't wear my glasses, therefore my vision hasn't changed, really just isn't picking up the subtle things that that they may be missing.
Sometimes people just think about it in terms of how am I seeing or do I need glasses, but it's more about the overall health of the eyes. And sometimes there can be changes with that people might not realize or have any symptoms for. So that's why it's important just to have a regular checkup, even though you may not have any special concerns.
So I guess my view and my mission for Advanced Focus Eye Care is just providing a higher level of care that involves oftentimes a little bit more time spent with the patient. And also we want to really customize each exam. We want to make sure that we're listening to our patients, asking the right questions, and then addressing their needs. I really like to make sure that patient education, that their conditions are understood, and that we also try to always offer things they can do to protect their eyes over the course of their life. I want to make sure that every patient is comfortable and leaves with a greater understanding of the things they can do to protect their eyes.